Hey, today I am going to discuss a very important topic which is commonly tested in the examination like MRCP, which is also very much important in day-to-day clinical practice. So let's look at the scenario first. So a patient came with the pneumonia, then he has got some treatment. Now he is presented with diarrhea. So in case of MRCP part 1, which is more focused on the diagnosis of the disease, so the question would be on the most likely diagnosis of this scenario. But in case of MRCP part 2 written, which is more focused on investigation and management. So in case of MRCP part 2 written, with this same scenario, the question would be on the investigation to confirm the diagnosis or the management of the patient with the same scenario. It is even important in PACES exam. This scenario specially used in the brief clinical consultation station, and in that station you need to take history and do some examination, and then you have some differential diagnosis, and with the examiner you need to tell the differential diagnosis and how to differentiate all the diagnosis and how to cleanse the most likely diagnosis from that, and what would be the investigation and the management protocol. They will ask you about some basic things about the pathogenesis of the disease. So now let's look at the differential diagnosis first, because it's my strategy that I look at the differential diagnosis first, then I study about the differentiating point, because compare contrast study is very much effective to remember some diseases. Okay, so compare contrast, always compare contrast is so much necessary. So let's look at the differential diagnosis first. So for this scenario, the most likely differential diagnosis for most likely diagnosis would be antibiotic associated diarrhea. Antibiotic associated diarrhea. What is antibiotic associated diarrhea? Antibiotic associated diarrhea is unexplainably introduction or unexplainably beginning of diarrhea after introducing antibiotic to patients. It is told that unexplainable, but there is some pathogenesis, like we all know that there are some normal flora in our gut, but when we give the patients the broad spectrum antibiotic, it causes destruction of that beneficial bacteria, so the harmful bacteria got upper hand and they cause some other diseases. And the other most important differential diagnosis is atypical pneumonia. Patient primary problem was pneumonia, right? And within the period of the treatment, he has also developed diarrhea. So in case of the atypical pneumonia, the patient can present with the GI symptoms. So what are the atypical pneumonia? Atypical pneumonia, chlamydia, mycoplasma, legionella. So, but in case of atypical pneumonia with the symptoms of pneumonia, there are some other symptoms. I hope to make a separate video on atypical pneumonia in very near future. So don't worry. So today I will focus onto the antibiotic associated diarrhea. So with these two major differential diagnoses, we also have to keep in mind some other diagnoses, and which is like that maybe the patient is suffering from some chronic condition, and this is the consequence of that chronic condition, like any GI tract pathology like inflammatory bowel disease, or we have to keep in mind this may be a case of carcinoma. We should not miss that. If the patient is elderly, if there is any history of weight loss or anemia or GI tract bleeding, so we need to rule out that part of the history in history taking section. So, and we also have to check the thyroid function status, because hyperthyroidism causes diarrhea, right? But in case of hyperthyroidism, the patients may present with some other presentation or some other features of hyperthyroidism. Okay, now this is mainly antibiotic associated diarrhea. So we now want to focus on some point of the antibiotic associated diarrhea. Timing is important. Timing is important that it can occur within 2 hours to 2 months after initiating of antibiotic. In some other reference book, it is told that up to 10 weeks it can occur. So the drug history is so much important in this type of scenario. So drug history is important, and for how long, the previous 2 months drug history or previous 10 weeks drug history is important if the patient has got any kind of antibiotic or not. And the other drug history is important in this type of scenario because laxative abuse also causes diarrhea, or laxative use also causes diarrhea. So we need to rule out that if the patient is using the antibiotic and also the laxative, if the patient is using the laxative or not. So what is the most common organism? Most common organism responsible for antibiotic associated diarrhea is Clostridium difficile. Some other organism may cause this, but this is most common, and percentage is 5 to 25% in cases where antibiotic is introduced, then this can occur, the antibiotic associated diarrhea, and this is depending on the type of the antibiotic, because some antibiotic causes more antibiotic associated diarrhea than others. So how can we prevent? We can prevent by limiting the use of antibiotic. We shouldn't give antibiotic without any rational cause. Okay, and uses of probiotics may also have some beneficial effect and some effect on diminishing the antibiotic associated diarrhea. So how we can confirm that this diarrhea is due to Clostridium difficile? We can confirm by identifying the Clostridium difficile toxin in the stool, and the method is ELISA or PCR, and the toxin is cytotoxin A and cytotoxin B. But with the PCR method, we can only diagnose the cytotoxin B. So what is the management? The most important management step is to stop the culprit antibiotic. Okay, so but patient has presented what is the primary problem of the patient? That patient is suffering from some infectious disease, right? So sometimes it is impossible to stop the antibiotic. So in that case, what will we do? What will we do? We just switch the antibiotic to another antibiotic which is less likely cause the antibiotic associated diarrhea. So which are those antibiotics? Those are aminoglycoside, vancomycin, tetracycline, macrolide. So some other antibiotics also. And now I have to mention an important point, that avoid antiperistaltic like loperamide and opiates. So what about the specific treatment? Specific treatment is, the first line is metronidazole and second line is vancomycin. Of course, oral vancomycin, okay, oral vancomycin, and vancomycin is second line when metronidazole is not tolerable or there is poor response after initiating the metronidazole, then we can try the oral vancomycin. Okay, so and in case of pregnant lady, we can use the vancomycin. So what are the complications? Now, the complication is pseudomembranous colitis and also toxic megacolon. So abdominal X-ray is mandatory to rule out the toxic megacolon. It also may cause the perforation and also shock. So monitoring the vital sign is so much important, and also monitoring the is there is any symptoms for perforation is occurring or not. So we have to monitor for the complications in this patient. So that's all for now about the antibiotic associated diarrhea, and in near future I will try to give some more information and some more variation variation of antibiotic associated diarrhea, and till then please be with me, subscribe my channel, and bye bye.